Welcome to the local edition, news and information to keep you connected in the Catskills, Northeast Pennsylvania. I'm your host, Jason Dole. There's no getting around the winter storms that are heading our way. We've already experienced a couple of them. And the doctors at Garnet Health want both the snow enthusiasts and the snow adverse to be prepared and safe around snowblowers. Each year, thousands of people suffer serious damage to their fingers or hands due to the improper handling of snowblowers. Radio Catskill's Patricio Robayo spoke to Dr. Victor Todisco, Vice Chair, Garnet Health Diagnostic Imaging Department, on how to stay safe this winter. And this is Dr. Todisco.
Almost every year, it seems, when we have the first heavy snow of the year, I'll see an X-ray of someone's mangled fingers. And I mentioned this to the head of the ER, and I said, we should try to get word out there, and maybe we can prevent some of these injuries. And at first you might say, well, how does someone, get injured from a snowblower? And what happens is that the snowblowers often get clogged when it's a heavy snow. Now, every snowblower comes with a tool attached to the machine, so you have it with you. It's called a clean out tool, and that's what you're supposed to use to clean the chute. And unfortunately, some people still stick their hands into the chute, and what is probably happening many times is that they turn off the machine and think that it's safe to stick their hand in there. But if it's clogged, even if you turn it off, there is built-up tension, and when you unclear it, it's going to suddenly move. And if your hand is down there, it'll grab it. So you should follow the directions in your owner's manual. I looked at a few over the weekend from Toro and Troy Built, and they all say never put your hand in the chute. Use the tool that's attached to the machine. And if you do that, we can avoid, there's online you could look up and you get various estimates from 3,000 to 6,000 hand injuries every year from snowblowers. And it has stayed the same for 20 years. It hasn't gone down. So people just need to be aware, even when they're turned off, you never put your hand in the chute.
Definitely. That leads me to my other question. You talked about some of the numbers nationally. Have you seen any injuries so far this year, this season?
We haven't seen any yet that I know of. We didn't have much snow yet, and we want to keep it that way.
If someone does put their hand in the chute and the hand does get mangled or something worse, what can they do?
If it's bleeding, you wrap it up and you apply pressure to stop the bleeding, and you head right to the hospital or the emergency room. God forbid you had a finger cut off, you bring it with you. Maybe you can reattach it. And that's pretty much it.
You said previously that the best way to prevent this is to use that special tool that came with the snowblower and not to have stick your arm or stick your hand inside the chute to clear snow. I know from experience, having wet snow on the ground like we had recently, it does make the snowblower work harder, and snow does get impacted in that chute. But you said to prevent that, use that shovel, use that special pick that happens to come with the snowblower.
Right, and your instruction manual for snowblower talks about that. It would also talk about if the snow is very, very high, very deep, you sometimes have to take smaller bites. You have to go slower. It's hard for humans to shovel. It's hard for the snowblower when it's heavy enough and deep enough.
And Doctor, this winter with the snow and ice coming down, what else can we do to stay safe? What other dangers are lurking behind that snow?
Well, we should also talk about heavy snow causing heart attacks. Heavy wet snow is also often referred to as a heart attack snow, and there's a definite increase in heart attacks after a heavy snowfall. And if you look on the website, the American Heart Association, they have various recommendations, but you have to remember, a heavy snow, if you've shoveled a heavy snow, it's a complete body workout. It's not just your arms, it's your shoulders, it's your back, it's your legs, and it can raise your blood pressure and raise your heart rate as much as a treadmill stress test. If you ever have a stress test at the cardiologist's office, you're on a treadmill, they start increasing the speed and increasing the angle, the slope of the treadmill, and they monitor your EKG and your heart rate and your blood pressure. And shoveling a heavy snow can raise your blood pressure and your heart rate as high or higher than a stress test on a treadmill. Plus, the cold air can also cause some vasoconstriction, constriction of the blood vessels. All of this is extra stress on the heart. Now, you wouldn't go out and run a triathlon without a doctor clearance and without training for it, without warming up. So you have to look at a heavy snowfall as that kind of a challenge. You really shouldn't do that if you're not in the shape for it. And the American Heart Association has some just general tips about shoveling snow, right? You should warm up first. You should take small bites with the shovel or use a smaller shovel. You should dress appropriately, and you have to be aware of any signs of a heart attack, like chest discomfort. Sometimes discomfort is not in your chest. It could be in your arms, your back, your neck. It could radiate to your jaw. You may have nausea, cold sweats, any symptoms like that. You might be having a heart attack. You should call 911 or get to the hospital. But the key is to prevent it and not overdo it in the first place.
Yes, definitely. Take it slow. And, if you haven't been active until then, definitely take breaks and take it slow. Definitely, for me personally, I can speak from experience, that does definitely help. Yes.
And even with a snowblower, actually, there was one study over a 15-year period. There were 90,000 ER visits. This is a study from the University of Indiana, came out in 2020. 90,000 ER visits between 2003 and 2018. Half of those were for injuries to the hand. There were also about 650 cardiac deaths during that time period. Because even pushing a snowblower is quite an exertion if you're not used to it.
Yes, definitely. Doctor, thank you so much for joining us on the program, letting us know how to stay safe during this winter, during a heavy snowstorm, through any snowstorm, whether we're shoveling or using a snowblower. We're talking to Dr. Victor Todisco, Vice Chair of the Garnet Health Diagnostic Imaging Department, letting us know how to stay safe this winter. Doctor, thank you so much for joining us on the program.
Thank you for having me, and everyone stay safe out there. I love the snow, but we have to just respect it.
For Radio Catskill, I'm Patricio Robayo.